Your body has been quietly sending you messages in your skin, your breath, even the way your urine looks, and most people miss every single one of them. Today, I want to walk you through 17 signs that your kidneys might be struggling, because catching this early could genuinely change or save your life. I'm a Dr. Kenneth Young, and kidney disease is something I deal with on a near daily basis. Here's what shocks most people. Roughly 9 out of 10 individuals living with chronic kidney disease have absolutely no idea. None. That's not a typo. It's a public health crisis hiding behind a very quiet organ. Now, most of us know the kidneys clean the blood, but these two fist-sized organs tucked just below your ribs do a whole lot more than that. They fine-tune your salt, potassium, and fluid balance. They regulate the acidity of your blood. They trigger red blood cell production and help keep your bones strong. So when they start to fail, the ripple effects touch nearly every system in your body. Let's go through them one by one. Sign number 1, foamy urine. The first thing I want you to pay attention to is what your urine looks like. Not bubbles that disappear in a second. I mean a thick, persistent foam sitting on the surface, almost like the head on a draft beer that just won't go away. That foam is a red flag for a protein called albumin leaking out of your blood and into your urine. Here's why that matters. Inside each kidney, there are roughly 1 million tiny filtering units. Each one contains a microscopic bundle of blood vessels lined with specialized cells that extend delicate finger-like projections. Together, they form an incredibly precise living barrier. When that barrier gets damaged, those projections retract, gaps open up, and albumin slips through. And because albumin behaves a lot like a mild detergent, it literally froths when agitated, which is exactly what happens in your toilet bowl. That froth is your body trying to get your attention. Sign number 2, swelling in the legs and face. Here's a quick test you can do right now. Press your thumb firmly into your lower shin, right against the bone, for about 5 seconds. When you lift your thumb, does it leave a dent? If so, that's called pitting edema, and it connects directly to the albumin loss we just talked about. Albumin doesn't just leak out randomly. In healthy blood, it acts like a sponge, keeping fluid inside your vessels. When albumin levels drop, that fluid seeps out into surrounding tissue. And because fluid follows gravity, it collects in your legs and feet first. You might also notice puffiness around your eyes in the morning, particularly in the loose skin beneath them. But here's the irony. Even though your body looks swollen, your blood vessels are actually running low on circulating fluid. So your kidneys, thinking you're dehydrated, hold on to even more salt and water. That makes the swelling worse. It's a loop your body can't escape on its own. And in serious cases, that fluid can push into the lungs, making it genuinely hard to breathe. Now, not all leg swelling is kidney-related. If your legs swell after a long day on your feet and are completely back to normal by morning, that's usually benign. But swelling that persists, especially if it's showing up around your eyes, is worth investigating. Sign number 3, nighttime urination. Here's one of the biggest myths I encounter. People assume that urinating frequently means their kidneys are doing great. That's not how it works. One of the earliest things kidneys lose when they're in trouble is the ability to concentrate urine, especially overnight. Normally, a hormone called ADH kicks in at night to tell your kidneys to hold water and produce a smaller, more concentrated batch of urine, so you can sleep through without waking up. When that concentration ability starts to break down, your kidneys just produce dilute urine all night long. If you're getting up 2, 3, 4 times a night to use the bathroom and nothing else has changed, no new medications, no extra fluids before bed, that pattern is worth bringing up with your doctor. Sign number 4, nail changes. Take a look at your thumbnails. It's completely normal to see 2 distinct zones, a pale whitish arc at the base, called the lunula, and the pinkish nail above it. Now, some people with advanced kidney disease develop what look like a similar 2-tone pattern, but it isn't a lunula. The lower portion appears white, while the upper half takes on a reddish-brown tone. These are called half-and-half nails, or Lindsay's nails. We're still not entirely sure what drives this change at a cellular level, but the association between this nail finding and kidney disease is well established. If you notice this in yourself or someone you care for, mention it to a doctor. Sign number 5, skin deposits/calcinosis cutis. Healthy kidneys constantly regulate how much phosphate stays in your blood. Phosphate comes from food, meat, dairy, processed snacks, and most of us consume well above what the body actually needs. That's fine when the kidneys are working, because they quietly flush out the excess. But when kidney function declines, phosphate accumulates in the bloodstream. The problem is that phosphate has a strong attraction to calcium. They bond together and form tiny crystals that can deposit in soft tissue. When this happens in the skin, it's called calcinosis cutis. Firm, chalky, whitish-yellow nodules just under the surface. They're usually painless, and if they break open, the material that comes out looks almost like a thick paste. This also appears in certain autoimmune conditions. As a rheumatologist, I see it more than most physicians. But when it shows up alongside other kidney symptoms, it tells me something important about what's happening systemically. Sign number 6. Arterial calcification. The same calcium phosphate crystals that deposit in skin can also target blood vessel walls. And that's where things become genuinely dangerous. Arteries are normally elastic. The smooth muscle cells in their walls stretch and recoil with every heartbeat. But when those cells are exposed to high phosphate levels, they stop behaving like muscle cells and start acting like bone-forming cells, literally mineralizing the artery walls. You end up with vessels that are stiff and calcified instead of pliable. On an X-ray, you can actually see the arteries lit up like bones, which is deeply abnormal. I sometimes describe it to patients as feeling like a guitar string running under the skin. When arteries lose their flexibility, blood pressure becomes harder to control, and the heart has to work significantly harder. This is a major reason why kidney disease and cardiovascular disease go hand in hand. Sign number 7. Muscle cramps. The same hormones the body uses to manage phosphate buildup also disrupt calcium absorption. One hormone in particular essentially blocks the active form of vitamin D, which the intestines need to pull calcium from food. As calcium levels fall, muscles become hyperexcitable, and the result is painful, involuntary cramps, often striking in the middle of the night just as you're drifting off to sleep. Low magnesium and excessive blood acidity, both common in kidney disease, can compound this. So if you're being jolted awake regularly by leg cramps and there's no obvious explanation, it's reasonable to ask your doctor for a basic metabolic panel and a kidney function check. Sign number 8. Bone fragility. Your skeleton is not static. It's in a constant state of remodeling. Bone is broken down and rebuilt on a daily basis. Calcium is central to that process. And when blood calcium drops chronically, your body calls on a backup system, parathyroid hormone, which signals bone cells to dissolve bone and release calcium into the blood. That works as a temporary measure, but months or years of this leaves bones progressively weaker. The medical term is renal osteodystrophy, though the practical outcome looks a lot like osteoporosis. One thing I specifically ask patients about is whether they've noticed any unexplained loss of height. That's a subtle but telling sign of vertebral compression. A fracture from a minor fall, particularly at the wrist, hip, or spine, is a more dramatic version of the same problem. Sign number 9. Itchy skin. When the kidneys can't clear waste products efficiently, those toxins build up in the blood, a state called uremia. The skin is often where uremia makes itself known first. One of the most maddening symptoms is a relentless, full-body itch with no rash, no obvious cause, and no relief. It tends to peak at night. Uremic compounds accumulate in the skin and irritate nerve endings directly. They also activate a specific itch receptor, PAR2, which amplifies the signals your nerves are sending. In prolonged kidney disease, these toxins can actually sensitize the itch circuits inside the brain itself, making the sensation feel inescapable. I had a patient, 57 years old, came in after scratching himself raw for weeks, who had no idea his kidneys were the problem. Advanced kidney disease was the culprit. Sign number 10. Restless leg syndrome. Restless leg syndrome is an irresistible urge to move your legs, usually worse when you're lying still and trying to sleep. It's aggravating and it significantly disrupts rest. The most accepted explanation involves dopamine. Your brain needs adequate iron to manufacture it, and when iron is low, dopamine production falters, triggering that crawling sensation in the legs. But where does kidney disease come in? Uremic toxins drive inflammation, and inflammation triggers the release of a hormone called hepcidin, which normally protects you during infections by locking iron away in storage and preventing new absorption from food. This is helpful when there's a real infection to fight. But in uremia, hepcidin stays elevated even without any infection, chronically depleting the body's usable iron. The result is functional iron deficiency and, with it, restless legs. Sign number 11. Metallic taste. Imagine sitting down to your favorite meal and it tasting like you're chewing on loose change. That's the reality for many people with advancing kidney disease. As urea, one of the main waste products the kidneys normally clear, accumulates in the blood, some of it migrates into saliva. Bacteria naturally present in your mouth break it down into ammonia and other compounds. Those byproducts stimulate specific taste receptors on the tongue in a way most people perceive as distinctly metallic. This also affects breath. When those same breakdown products are exhaled, the breath takes on a urine-like odor, something clinicians refer to as uremic fetor. It's unpleasant, and combined with the taste disturbance, it plays a significant role in what comes next. Sign number 12. Nausea, vomiting, and appetite loss. Between the metallic taste and the smell, appetite naturally suffers. But uremia has a more direct route to making you feel sick. Deep in the brainstem, there's a region called the chemoreceptor trigger zone. Unlike most brain tissue, it's not shielded by the blood-brain barrier, which means it can directly sample blood chemistry. Its job is to detect toxins and initiate vomiting to expel them, an evolutionarily brilliant defense. Unfortunately, uremic toxins register on this sensor just as real poisons would. The result is persistent nausea, bouts of vomiting, and a brain that's constantly signaling your body to stop eating. Over weeks and months, this leads to unintentional weight loss. Sign number 13. Easy bruising and bleeding. Most of us bump into things and barely notice. Maybe a faint bruise appears and fades in a few days. But patients with kidney disease often develop large, dramatic bruises from what seemed like nothing at all. The mechanism lies in how uremic toxins interact with platelets, the small blood cells responsible for clotting. In a healthy body, platelets rush to an injury site and stick together to seal the wound. Uremic toxins reduce that stickiness significantly. The plug doesn't form as quickly or as firmly, so bleeding continues longer than it should. You might notice this as gums that bleed more readily when you brush, more frequent nosebleeds, or skin that bruises at the lightest touch. Sign number 14. Uremic frost. This one is rare, and I want to be clear. If you see this, things have gone very far. Uremic frost is a fine white powder that appears on the skin, particularly the arms, face, and neck, when sweat dries and leaves behind a crystallized residue of urea and other waste products. It means the kidneys are so overwhelmed that toxins are essentially seeping out through every available surface, including sweat glands. I've seen images that look almost like someone dusted the patient with chalk. It's a sign of end-stage kidney failure, and it requires immediate medical attention. Sign number 15. Pericarditis. Uremic toxins can also trigger inflammation of the pericardium, the thin, fibrous sac that wraps around the heart. When that membrane becomes inflamed and irritated, every heartbeat causes the heart to rub against the inflamed surface. Patients describe a sharp, stabbing chest pain that often gets worse when they lie flat and improves when they sit forward. When I put a stethoscope to someone with uremic pericarditis, I hear a characteristic friction rub, a scratchy, leathery sound in sync with the heartbeat. It's one of those clinical findings that is genuinely unmistakable once you've heard it. This is a complication of late, inadequately managed uremia, and it's a prompt to escalate treatment urgently. Sign number 16. Fatigue and anemia. Exhaustion is probably the symptom my kidney patients mention most, and there are plenty of reasons for it. Disrupted sleep from cramps, itching, and restless legs, electrolyte imbalances, the chronic burden of toxin accumulation. But there's one additional driver that's particularly important: anemia. Your kidneys produce a hormone called erythropoietin, EPO, that signals bone marrow to generate red blood cells. When kidney function declines, EPO production falls and red cell counts follow. The result is fewer cells to carry oxygen throughout the body, so even mild exertion, a flight of stairs, a short walk, becomes genuinely exhausting. The good news here is that synthetic EPO exists and is highly effective. Injections of it can meaningfully reverse the anemia of kidney disease. It's one of the more satisfying treatments we have available because patients often feel dramatically better within weeks. Sign number 17. No symptoms at all. This last one might be the most important. Many people with chronic kidney disease, especially in the early stages, feel completely fine. Stage 1 through early stage 3 often produce no noticeable symptoms whatsoever. The disease is frequently discovered by accident during routine blood work or a urine test ordered for something unrelated. That's why preventive monitoring matters so much. If you have diabetes, high blood pressure, a family history of kidney disease, or a habit of regularly using over-the-counter anti-inflammatory medications like ibuprofen or naproxen, your kidneys deserve a periodic check-in. Those NSAIDs in particular are something I think people don't take seriously enough. They're easy to reach for, but chronic use can quietly damage kidney tissue over time, as well as affect your stomach and cardiovascular system. The kidneys are extraordinary organs, and they're more resilient than people give them credit for, but only up to a point. Catching problems early is where we can actually make a difference. If any of what I've described today sounds familiar, please bring it to your doctor and ask specifically about kidney function testing. It's a simple blood and urine test, and it could tell you a tremendous amount. Stay curious, stay proactive, and I'll see you in the next one. Disclaimer: the information presented in this video is intended for educational purposes only and is based on published, peer-reviewed scientific research. It does not constitute medical advice and should not be interpreted as a diagnosis, treatment recommendation, or substitute for professional medical consultation. Individual health circumstances vary significantly, and what is appropriate for one person may not be appropriate for another. If you are currently undergoing cancer treatment, have been diagnosed with a serious medical condition, or are taking prescription medications, please speak with your treating physician or oncologist before making any changes to your diet or health protocol. The studies referenced in this video are real and publicly available, and I encourage you to read them. But